Did you ever wonder what's a hospital's responsibility to provide you with informed consent? And what about proxy consent, which happens, for instance, when parents make a decision for their children? More specifically, I'd like to examine newborn circumcision consent. How does the interaction between the proxy parent and the hospital have a role in influencing whether a circumcision happens? Obviously, healthcare providers are part of the birth process, and that places them in an ideal position to influence or even pressure parents to cut their sons. When a maternity patient is admitted, they're in essence captive customers, and hospitals strive to maintain revenue via insurance reimbursements, and circumcisions are revenue. Can healthcare facilities provide unbiased information, especially when there's little regulation governing this, and they're really left to their own discretion? We've heard some healthcare systems disingenuously use solicitation, misinformation, or they withhold information to get parents to sign on the dotted line. But how really widespread is this? And speaking of circumcision, it's gender-based violence against children, and I will continue to expose the systemic practices and cultural bias that misleads Americans into cutting their sons. Well, I want to introduce you to someone who's working really hard to document this informed consent issue. My friend Matt Goodwin is doing some research to help us understand what's really going on in hospitals. Are new parents getting accurate, balanced information, or is cultural cutting bias baked in? Let's ask Matt what he's digging into. Maybe we can find something out. Let's go.
Anthony, thank you for taking time today to talk with me about this important project. As a soon-to-be parent, when I first read about infant circumcision in detail, I came across articles that mentioned problems with informed consent and lack of information provided to parents by healthcare providers. These inadequacies were cited as a reason why parents continue with this harmful practice, but I hadn't seen a clear example of it yet. I was really curious what parents were reading or not reading, but still proceeding with something so incredibly awful to their newborn, despite the overwhelming evidence of harm. If there was something off here about what was presented to parents, then there was an opportunity to do something about it. I had to know. So to achieve informed consent, medical providers must explain the condition to be treated, provide an accurate description of the procedure, list all inherent risks, list potential benefits, and explain alternatives or non-treatment options. The purpose of this process is to allow the best opportunity to weigh risks against benefits and obtain legal permission to proceed. Infant circumcision is a unique consent process because it is by proxy. The patient, the child, is not consenting. It's the parents who are requesting to remove healthy tissue on their behalf. The ethical issue here, of course, is that the person who must live with the consequences of the surgery is not themselves consenting to it.
Right, but now hospitals should be getting signed consent forms. So how do we get to see what they're using and what they're actually telling parents?
Well, what I needed to do was obtain the actual forms parents were reading and signing to evaluate them. So I set out and asked hospitals for them. To my surprise, I was met with a decent amount of resistance from healthcare providers when I asked to get a copy of their form. I really had to try a variety of methods to get them. In most cases, I was able to request these forms through email communications, but I really had to convince the person on the other end as to why I needed to see these forms in advance. I received help from a lawyer who had been involved in court cases regarding botched circumcisions in Massachusetts, and they were able to provide some forms contained in the records. At some hospitals, I was denied access to these forms, so I was able to bypass the gatekeepers by getting assistance from internal advocates that included nurses, midwives, and even hospital employees. I'm still working on a few hospitals, but at present we have 20 forms in total across Massachusetts and New York.
So has there been anything that stood out to you so far? You've been working on this for a while. What are you seeing initially?
Yeah, so with a procedure that's being performed on more than half of all infant males in the US, I really expected to see a uniform consent form across all the major hospitals. With something so common and routine, why wouldn't they be? Within 2 weeks, though, of the investigation, I realized there was something seriously wrong with what I was seeing. The most shocking discovery to me is how radically different each form is from hospital to hospital. Parents aren't receiving equal information and they aren't consenting to the same things. These consent forms are far more deficient than anyone has ever realized, and it's across the board.
Once you gather all this information together, what do you plan on doing with it?
I think the information collected so far is worthy of a journal publication. The goal of the publication would be to ultimately encourage legislation to establish a better informed consent process than we have now. If we can get more information to parents, the less likely they are to proceed with a risky, non-beneficial surgery on their newborn's genitals. No one should be against more transparency and more information, especially if it leads to better health outcomes.
And how can people help you?
Well, right now I'm busy writing up the paper for submission to the Journal of Medical Ethics, but I'm also trying to fundraise for the cost to publish open access. I believe it's important to make these findings widely available and not closed behind a paywall. If anyone would like to help with this important project, donating to the GoFundMe would be one easy way to do so. It's expensive to publish in a reputable, peer-reviewed journal, but I think it's worth it for the potential impact the study could have on discontinuing routine infant circumcision.
I think this is a really worthwhile project because we don't have an idea of what's going on with the circumcision consent process in hospitals. Once Matt collects all of the data in the states he's working on, he's going to publish the findings in a reputable journal so anyone can see what circumcision consent is really looking like. I think this is going to shine a lot of light on an issue that doesn't get much exposure. And it will be an important resource, especially when we talk to legislators about improving the circumcision consent process. Because for too long, hospitals have been able to do what they want and say what they want. And this all leads to more cut babies and more regret parents. Be part of this project. Go to Matt's GoFundMe page and hit the donate button.